Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi, your host on Your Body's Natural Pharmacy. And I have my co-host...
Hello, folks. This is Dr. Anju Sodhi, and we are speaking on the hormonal imbalances today.
This topic is such a huge topic, Dr. Anju, that I think I see my share at clinic almost every time I'm seeing patients, and I'm sure you see quite a bit of those as well.
Yes.
This topic probably we won't be able to cover every aspect of hormonal imbalance today, but I think it would be good for our folks to know that, we will probably bring more of this in the coming weeks, but we wanted to start somewhere today, so this will be the starting point. So folks, if you are having some issues where you've been told that you have a hormonal imbalance, please feel free to call us with your questions at 1-844-301-1250. एक बार दोबारा अगर आपको किसी ने बताया कि आप में हार्मोनल इम्बैलेंस है तो आप हमें हिंदी, पंजाबी या उर्दू में भी कॉल कर सकते हैं. कॉल करने के लिए नंबर है 1-844-301-1250. एक बार फिर 1-844-301-1250, 1-844-301-1250. हम दोनों डॉक्टर अंजू एंड मी आर हैप्पी टू लिसन टू योर क्वेश्चन एंड आंसर यू अकॉर्डिंगली. तो आज का जो टॉपिक है वो है हार्मोनल इम्बैलेंस. सो आई विल लेट डॉक्टर अंजू टेक ऑन इट, देन आई विल give my input as well. So Dr. Anju, so can you just start with what are we going to discuss today?
So today I will like to speak up on the when the hormonal changes start seeing, the menstrual cycle is the first thing which when the women start seeing the difference in their body. So I will like to talk about the menstrual cycle, what is the healthy menstrual cycle versus the imbalances like the PMS symptoms. I would like to talk about that. If you have any question regarding that, please feel free to call. And then also I will like to talk about premenopausal and menopausal symptoms and something like that.
Okay. So anyway, as we are noticing, you were going to address how the menstrual cycle begins in the young girls. That is like, I'm noticing the menarche have changed. Menarche is usually when the periods begins in the women.
Yes. So menarche, the usual age is it starts at the age 13 or 14, and the genetic plays also role. We can think of when the mother started their period, the girls usually start during that time. But then Dr. Shailinder, again, if we see according to the Ayurvedic point of view, which is the like Vata, Pitta, Kapha is the three constitution or the doshas. I think many of the listeners, if they know about the Ayurveda, they know about the Vata, Pitta, Kapha, which is air, fire, and water. So with the when the period started, the menarche at the 13 or 14, it's usually their dominant doshas also we can find out. So with the Vata dominant, girls can start their period at age 13 or 14. But if a girl is Pitta dominant, they can start their period as early as age 9.
Oh, wow.
And the Kapha dominant girls can be as late as age 16 too. So then there is like, that's their doshas, that's how their body is playing role.
So that's the based on the constitution. If the Pitta constitution, they might start your menarche early. But there is also the factors which I think we also want our listeners to know, that there is an environmental factor along with the genetic factor which
along
you play.
With the genetic factors. And also if you see the urban lifestyle or the rural lifestyle, that also plays major role too, starting the periods early or late.
Right. And I notice in the standard American diet, we usually call SAD, that's because it's not very healthy diet. So the girls who are obese, overweight, and there is much more fat volume in their body, they have...
So that's like the Kapha dominant too, and the Kapha imbalance could play a role in that cases too. And they can start.
Right. So, anyway, I will let you continue. So would you please specify a little bit more on...
Yes. So I will go with a little bit with the what is the healthy menstrual cycle, or what is like what you should expect with the healthy menstrual cycle. Or if I have some girls listening to this program too, so the flow should be bright red in color, and it should not stain the clothes. Now I know like girls use the tampons or the pads, but in the old time we used to have the clothing and then if it stains, that means it's not healthy. It has more toxins into it.
So can you just a little bit verify the stains? Because I think blood will stain up to certain extent, but you mean if you wash it, it needs to be washed out completely?
It will wash out completely. If it's on the clothes too, there should not be
if
stains.
If there is a stain left behind, according to Ayurveda, that means there is some impurity.
There is some impurity in it, yes. And like the smell, the odor, it should not be. There is a particular smell, but it should not be foul.
Right. And that might indicate there may be underlying some factors of imbalance or infection maybe.
Yes. And then there is how much, some women come and they say, oh, they bleed a lot or they bleed very less. So what is the average, what is the normal healthy flow? It should be, in Ayurveda, it says 4 anjali, which is like the 4 handful, it should be in the one fist with the both hands.
So that's a one day.
One.
Usually first 2 or 3 days that.
Yes. So 4 anjali is the regular, but it can change from the imbalances or what is the... So then we have the women, we have the what is the characteristics, the Vata imbalance. So Vata is one thing which really gets imbalanced during the cycle.
And this is one of the dosha which actually very easily get disrupted.
Yes. Food plays major role into imbalancing the Vata in our body too. And the women which has more the pain and discomfort into the body, it's much more the Vata imbalance. And
if you have not slept well,
that will also contribute into it. Then the Pitta imbalance, it would be, and the Vata imbalance, also would have not enough blood. They will be having less blood.
So much more anemic side, you will say.
And when the Pitta imbalance is there, it would be more blood, more inflammation, more the red, bright yellow. And it would be burning sensation too, and there will be more irritability you will be seeing into those type of
So
foods.
usually when we say Pitta, it's much more reflective of fiery type of
things.
Type of is it emotions are fiery and you feel burning sensation, burning pains, something like that.
And the Kapha imbalance again, Kapha is the heaviness. It's much more they just feel lethargic, they feel fatigued,
more
and
heaviness,
and the more yellowish, more mucousy, that type of blood it will be seen. So, there is always like the lifestyle changes to how to deal with these type of symptoms. So, I do tell my patients that menstrual cycle helps women to purify their body. It's an opportunity, not a problem. Respect that opportunity, facilitate it, and you will feel greater comfort. So, Dr. Shailinder, I recommend my patients for a healthy cycle to do regular exercise, which is very important. Get enough sleep, reduce stress by yoga and meditation. These days, stress is the major factor which can contribute into like the not having the healthy cycle or having the more PMS symptoms.
Right. The part of the stress reason is that women are actually working more and they are doing double job. I mean, they have to take care of their home issues, then they are cooking in the home, their homework, along with their working full time. So, and if they got children, then it's like, the double jeopardy, or I will call triple jeopardy.
Exactly.
So the amount of stress is there. So I think the partners or the husband and wife or they need to figure out to how to reduce those stresses and how to contribute to cut down the amount of work on the females in the house.
Yes. And also, like if especially for the young girls, when they start their period, they had like that they don't expect, like they are having issues. They do not like it. They feel it's a problem why they are having a menstrual cycle.
And I think that's where the open communication with the mom and daughter is a very important. Sometimes I think girls relate better to their mother in these issues. So also, if the mothers are listening, and if you have a young daughter, it's very important that you need to have an open communication and address it and discuss it. In case you don't know what type of conversation need to be taken place, it's better to get make an appointment with any naturopathic physician or Ayurvedic physicians like us, and we can help you to facilitate and answer the questions which your girl or daughter might have.
Yeah, and then like, these girls, like if they start their period like 14, 15, that's a stressful time, like that they are in their like the sophomore year or
in high school.
The stress level is high. And the other thing is like the lot of intense exercise too. So sometimes like they are into it and they don't know like when they are having the menstrual cycle, they have to take it easy. They have to rest. There should not be the strenuous exercises is not
especially
allowed.
Those who are in sports and quite a bit. Some of my patients I know are in soccer or heavy duty. So you would recommend them not to be participating fully.
Not to participate fully. Do some like the stress releasing, like the yoga, meditation, or whatever way you feel like de-stress yourself. That is very important. And some relaxing walk, 15 to 20 minutes is recommended every day. So walk is very helpful, easy, and rest is very helpful too. So
anyway, folks, we are discussing hormonal imbalances, and I, along with Dr. Anju, we are on Desi Radio 1250 AM. If you have a question, please feel free to call us at 1-844-301-1250. Again, 1-844-301-1250, and this is our direct line, and we'll be happy to take your question. I understand today is kind of really rainy and windy weather, so everybody's trying to stay in. So anyway, feel free to call us. And what else Dr. Anju?
So I will go a little bit more about what to do. So as I said, that more rest and a lighter diet is very important. A diet which is not like high in the fat and
especially fried
foods or the junk food or the McDonald's, that type of food is not recommended.
Fast food type of things, we need to stay away.
Yes, we need to stay away from those foods. And so Vata, as I talked about, the Vata which is here must be balanced. Then there can be a downward flow. Avoiding overstimulation is always helpful to soothe and balance Vata, which is why there is an emphasis on the rest So rest is very important.
Right. So during this phase, especially the first 2-3 days, I think it would be very much ideal that the women should take a little less load of work, or maybe relax if possible, or cut down the amount of work.
And Vata also can be balanced by a regular schedule, such as going to bed before 10 and eating meals at about the same time every day. Ideal foods for balancing Vata are warm, liquid dishes with a smooth texture, such as soup or vegetable purees are very good with a lot of ginger in it.
I do recommend my patients to, you need to have fixed schedule. That breakfast need to be done by 8 o'clock. You don't want to be too late, or maybe maximum 8 to 8:30. Lunch should be by 12:30 and dinner around 7. And need to give that much time, and hitting the bed on right time, like 9:30, 10 o'clock, and having 7 to 8 hours of sleep is very important to de-stress your body, and that gives enough time your body to do internal repair.
Yes, and I do suggest to avoid the raw and cold foods during that time.
So, folks, if you are a salad eater, so like Dr. Anju said, you don't want to eat too much of those during this phase of the first 3 to 5 days of the menstrual flow.
Yes. So, and then Dr. Shailinder, then I do suggest, like, there is some like the Ayurvedic herbs too, like the Sitavari. Some of people might know about the Ashwagandha and the Ashoka and the aloe vera. Those are the herbs which can be taken or throughout the like the menstrual throughout the month, not only during the menstrual cycle. So these herbs helps to aid in digestion and removes the toxin throughout the month. So the body has less work to do during the time of the menstruation.
Right. So these herbs are actually very, supportive herbs, which actually helps women to balance out their hormones and also help
and
the
the
flow.
Emotional balance too, because there is a emotional disruption at that time too,
right.
due to the hormonal
imbalance. And I think we will discuss as we go during this phase, because women do get sometimes irritable or sometimes VP, and all those things I'm sure it's coming in the next few minutes.
So all these herbs also helps to help to balance the doshas as well, the hormones, and it's very nourishing for the uterus and the genitourinary tract, and so it helps to manage the PMS symptoms. And the PMS symptoms are mostly the lot of mood swings, irritability, depression, anger, anxiety, so these are the main ones.
Right.
Or the cramping is the other one, which is
and
like
sometimes
really
women notice a little bit because of the fluid retention. They notice also weight gain and angry, irritable, anxiety, etc. Migraine and headaches.
And so those are I consider those the pitta imbalance into more, if we're talking about the Ayurvedic point of view.
Right.
And then the kapha imbalance comes, and then the lethargic, heaviness. Those are the kapha imbalances. If there is more kapha imbalance into the body,
so it will be much more heavy feeling in the body, heaviness,
lethargic, fatigued, depressed, sad. Those type of feelings.
And the heaviness in the breast and
heaviness in the breast too. So for all those, the basic thing is the eat well, do rest, and take some supplements. And also the other we have some of the the Regu cycle is a herb which you can get at the super supplement stores from Ayurved line too. Which is a good combination of the different herbs like aloe vera and stuff, and so which helps to balance the doshas too. And also some B vitamins are very important to take too.
Right, and there is enough studies indicating those B vitamins are very helpful with the PMS type of symptoms.
And also also Dr. Shailinder, I do suggest my patients the hot compressions oils, like the castor oil packs.
Those are such a wonderful thing.
Or the coconut oil packs for the external as well as internal. If there is a vata imbalance, then the castor oil pack is very good. And if there is a pitta imbalance, then there is a coconut oil pack is very good too. So yeah, and if you are getting a little bit confused, like the what imbalance you have, feel free to call us or feel free to come to the office. Our phone number is 425-453-8022.
And that's the clinic number. In order to reach us at the studios, I will advise you to call us at 1-844-301-1250. So that is the line to call, and you can also call us in Hindi, Urdu और पंजाबी. तो उसके फ़ोन करने के लिए आप हमें 1-844-301-1250 पे कॉल कर सकते हैं. तो हम आपके क्वेश्चन लेने के लिए रेडी हैं. तो आज का टॉपिक है हार्मोनल इम्बैलेंस. ये हार्मोनल इम्बैलेंस जो है नॉट ओनली इफेक्ट्स द वीमेंस बट इट आल्सो इफेक्ट्स सम ऑफ द मेन टू. सो वी विल कवर दोज question as we come. So, some of the things which we are discussing today, like Dr. Anju mentioned earlier, the very first things which you notice is, what are the main symptoms of hormonal imbalances, like weight gain, fluid retention, mood changes, PMS type of issues like anger, irritability, or anxiety, which can last for a few days to weeks, migraine and headaches, breast tenderness, heavy period or very light period. And usually, Dr. Anju, like when we are having this type of heavy or light period, there is an imbalance between estrogen and progesterone.
Yes. Yes. So then there is like the estrogen progesterone imbalance that need to be taken care as well.
Right. So anyway, we will take a short break and we'll be right back, folks. So feel free to call us at 1-844-301-1250.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
Hello folks, again this is Dr. Shailinder Sodhi along with Dr. Anju Sodhi, and we are discussing hormonal imbalances. So before our break, I gave some of the scenarios which might indicate what hormonal imbalance will look like. So since we are discussing this, the one of the things which I mentioned is feeling bloated, irritable. These are some indication that these may be an indicator of body being out of sync from the female hormones. There may be there is not a proper ratios of estrogen or progesterone. So a hormonal imbalance could be blamed for the feeling bloated and irritable. The way hormones work, they are like our chemical messenger, so which impacts the way our cell in the bodies behave, because they are actually, we have so many receptors in the body that each those receptors actually affected by the hormones. So this is one of the things which really affect us. And these, also it is normal for a lot of shift to see during the cycle, during pregnancy, during menopause. So, we can see these changes which coming in it. So we have a caller on the phone, and caller, go ahead. You are on the show, Your Body's Natural Pharmacy, and this is Dr. Shailinder.
Hi, Dr. Shailinder. This is Raman.
Hi, Raman. How are you?
Good. And I'm just calling in regards my weight gain. After my second delivery, I have gained a lot of weight, and lot of changes are coming in the body. Like I get so much water retention. My feet get so swollen by the end of the day. So much fatigue. Even though I get full sleep, 8 hours, but still I feel fatigue all day long.
Right. That's a very good question. Dr. Anju, what would you suggest to Raman?
Yes. So, Raman, are you having the regular menstrual cycle?
My cycle is completely fine. Yeah, 28-day cycle period. Always on time.
Always on time.
So,
Okay.
Usually in this type of cases, what I see is a shift in the hormones.
Yes.
That means there is either imbalances in estrogen and progesterone, and sometimes androgen hormones like testosterone can be a trigger point which leads to heaviness in the body.
Yes. Yes. So, do you take any have you had any blood test done, or do you take any supplements, or you may have to do a blood test done and see what's going on. Regular blood test can tell this too, or you can have a hormone test too. Sometimes the testosterone starts going high after the few, even though you were fine before, and then.
And I have seen that even ladies within the mid-30s sometimes could have an issue with the androgen hormones, which are testosterone, and sometimes there is a mild indicator if the precursor to the hormone, which we call DHEA, is imbalanced. That is too high, and that gets, rather than converting into estrogen or progesterone, it's getting converted into the testosterone. And that leads to it. And like Raman, you mentioned, sometimes what happens is with the swelling and all that. Also, these hormones also affects the electrolyte balance. So there could be, so you need to be careful with the salt and salty type of foods to make sure you're not overloading your diet with the salt and managing it. And hydration is so important. I do recommend 8 to 10 cups. Otherwise, the easiest way to figure out how much water you should drink is half of your body weight in, ounces. That means if you're 160 pounds, 80 ounces of water you need to drink every day to hydrate, and that way usually you can urinate out lots of the toxic load from the body.
So there is a lot of toxin like you had, so sometimes little bit of the detox is very important to do. That helps to get rid of the AMA toxins from the body as well from the during your menstrual cycle too.
Right, and cutting down the sugar.
So work on your diet, start drinking more water, start taking some herbs like sitavari and ashwagandha, regu cycle. Those are very helpful.
And I will probably add that, doing yoga routinely and a little bit walk, exercise, having some sort of routine will definitely help.
I have noticed that if I do walk, it makes a huge difference. If I do walk regularly, morning or evenings, then my swelling goes down.
Exactly.
But otherwise, if I don't do exercise, the swelling is always there, and also the fatigueness, especially by the after my menstrual, 10 or 12 days after that, I just start getting so fatigued till I get my next cycle.
Right. And make sure, Raman, that you are taking some multivitamin during this phase. Like Dr. Anju mentioned earlier, B vitamins are very helpful. So do take a multi along with it and improve in the diet. Cut down the, I will definitely say no junk diet, no standard American diet. And the way you mentioned, walking routinely, doing meditation, stress management, hydration will definitely help you. So I really thank you for calling us and putting this question. I'm sure this is not the only, you. There are probably lots of other people who go through the same thing. So these are the same recommendations for them as well.
Yes.
Thank you, Raman.
Thank you so much for taking my call and giving me advice.
You're very welcome. And we have another caller on the, I think there was a call drop during that phase, but that's fine. Caller, if you are still listening, feel free to call us. And before the call, that's a really very,
So, Dr. Shailinder, also, sometimes I forgot to ask her age. Sometimes, it starts the perimenopausal symptoms.
Right. That would be
starts as soon as from ages 30 to it can go up to 50. So
right. That phase can last for long time.
That phase can last for
in my personal view, Dr. Anju, I think that's usually an indicator of hormonal imbalance. If the perimenopausal type of things and hot flashes are happening, that's the body is telling that there is a drop in estrogen. It needs to be picked up. And that's a lot of environmental factors play a role in this.
Yeah, so environmental toxins are the really bad one these days too. So, and also the environmental as well as the dietary toxins. People eat some it's very important to eat like the organic foods these days. That is the another thing which why people are having a lot of issues.
My suggestion to is eat the cleanest as much possible. And that means the food which have not been sprayed with the lots of pesticides, insecticides, and these, and also they actually, these pesticides and insecticides sometimes behave like hormones in the body. Yes. There was one study done where the one of the chemical manufacturing company was dumping all these into the river, and the behavior of the fish was changed, and because it reversed the role of their estrogen to or the other hormone into different ways, so they were behaving very different. So that applies to human beings too. So I'm gonna, anyway, since you started on perimenopause, I will let you continue. So
why don't we start a little bit talk about because that's the huge topic for the perimenopausal and the menopausal symptoms.
And as you go, and then I will discuss a little bit more about other.
So what is the menopause? Menopause happens because the ovaries stop producing the hormones estrogen and progesterones. Periods can stop for a while and then it can start again. So therefore the only way to know if you have gone through menopause is if you have not had your period for a full 1 year.
So that's the class to call it somebody menopausal, that you don't have to have a period for one whole year.
So I get women all the time, they are having periods like they had the regular period and now it's from the 28-day cycle to it's 22, 23, 24, or then it starts going a little bit early and then it starts going like every 6 weeks, delayed. So all these are the signs of the perimenopausal symptoms. So average age of the menopause is 51, but for some women it can happen as early as 40 or as late as 55 too. So menopause is a natural, that means it happens on its own. It's a normal physiological phenomena in the body, and you don't need medical treatment unless your symptoms bothers you.
Right. Actually, a lot of women come and, I think some women grace it very graciously that this is the end of their productive age. They are not ready to conceive anymore. Others are not so gracious about it and they think this is the end of their very productive life.
Yes.
And, so there are two sides to this. So anyway, either way, if you are into menopause, there is help available, through the naturopathic approach and Ayurvedic approaches, which we do all the time at our clinic.
Yeah, so we try to avoid the hormone replacement therapy, but if it's needed, there is a natural hormone replacement therapy too, which is from the like the herbs and stuff too. So that can be done, but it's all depends. Like I always start with some herbs which are doesn't act as a hormones, but it works on your organs to balance the hormones.
Right, and I'm very much in sync with you on this. A lot of people come to me and they say that they need to have on hormone therapies because they're into menopause and they want to go on estrogen, progesterone, some sort of prescriptions during this phase. My approach is that I want to work with your body. I want to work with your ovaries. I want to work with your uterus. If you have those organs, I would like to utilize it. There is a reason why women go through the menopause.
So it's so interesting. Sometimes like we are like taking care of, like we will take some B vitamins too. We will do something for our digestion too. We will do a lot of things. But sometimes women forget, like they have something else too, which need to be taken care by doing some certain things. So these phases can be more comfortable.
Right. So, the menopausal phase, does bring its own challenges.
Yes, its own challenges. It can be not too challenging for some women, but that also tells me like women with the unhealthy diet and not exercising and a lot of stress in their life, so they feel it more.
So one of the things which I noticed, there is a sleep behavior changes.
Sleep behavior changes. If you are not sleeping enough, as you start like having more sleepless nights, so that's an indication that
that hormonal imbalance is there and we need to do something about it.
Yes, and depressed mood, age, and the menopause status are the main factors associated with the sleep disturbance.
Right. So there's an easy fix for these individuals is to meditate, to do the breathing exercise, do the stress reductions, and a little bit exercise that, and see if that induces the sleep pattern back into balance.
Yeah, so I would like to go over a little bit more on the what other symptoms you can see with the perimenopausal or the menopausal are like the so irregular period is the first thing for the perimenopausal, and then the hot flashes.
So that is so common. That is so common.
So
I
common.
hear that all the time.
All the
Some
time.
of the women get very smart hot flash that is like short period which lasts for a few seconds, and other women actually suffer chronic hot flashes throughout the day, even at their night, and they sweat like they say they can wet their clothes with the
Yes.
amount of sweating happens.
Yes, and then the low libido or no libido.
That's another
That's
indication.
another indication. Vaginal dryness. That's
Right.
another. Urinary frequency. Like the women starts complaining about like the frequent urinations. Insomnia. We talked about that.
Mood changes happen.
Mood changes and. Like then the forgetfulness, they say that though they can't remember, their memory was so sharp and now they can't remember anything.
So I mean there is a reason, I mean, why that happened also. I mean there is a lot of the way a lot of people thinking and the scholars have thought why the memory or forgetfulness happens, because these hormones actually work through the neurotransmitters.
Yes.
And sometimes those clicks do not happen, those synapses at the neuroendal doesn't happens, and we are not able to recall things. So, folks, all of a sudden, if you're noticing that you're having hard time recalling things, or you can't remember what happened this morning by the evening, it can be an easy fix.
It can be, yes.
That is mean is that let's focus on balancing your natural hormones.
Yeah, and then also women starts complaining they have started gaining weight more around the waist. So that is another indication that there is something need to be taken care.
Right. It's so important. It is so important. We really need to understand the level of hormones which changes throughout the life, in the women, and how we need to balance it. Definitely, we are not going to have the same amount of hormones when we are in the young teenage to mid-20s. They usually start dwindling down.
Yeah, it starts declining from the age 30. Actually, it starts declining.
Right.
And then there is some aggravating factors for the like the menopause is the smoking, like the unhealthy diet.
So I think the women who smoke, they actually have more symptoms of the severe, I will call them menopausal symptoms. They will definitely
Yes,
notice.
they will definitely feel more symptoms, and as I talked earlier, like the diet and the lack of exercise, and the alcohol is the another thing, which is like if there is an alcohol abuse, they will have more symptoms.
All right, and I mean I get those patients too. They say, doctor, we don't drink too much, but it is one of the things which when we start drinking, we cannot control it. Then there is an issue with it. I mean, usually there is a healthy amount of alcohol which can be taken, but I usually recommend not to drink on daily basis. It's not something you want to deal with, especially because it does put a load on the liver, because all the alcohol which we drink get converted into the aldehydes, and liver has to clear it. It can take few days before the liver can purge that out.
So that is the another thing, like liver has to be very happy because it has to take care of the everything, all the like the hormones and everything. So always at the office, we always like to address the liver as well. We are taking care of the other stuff.
The one thing I want to bring to your attention, Dr. Anju, is sometimes I have noticed, I mean, there is a teenage acne, and sometimes it's a post-menopausal acne. All of a sudden, women start noticing that they are breaking out as their. So that's usually an indication of androgen.
Yes, so women starts having like little bit more androgen as testosterone hormones than they had in their like the early ages.
And that also sometimes hairy growth which can happen on the facial, which sometimes really puts the women down and they feel very depressed about it.
And it's happening at the middle age, like it was not happening before, and it all of a sudden started happening. So
right. So in the on the reverse side, men start having sometime reverses. That means men start having more estrogen in there. So it does happen somehow naturally. There is a one way body decides, converting the testosterone into estrogen, whereas in the women's the conversion starts going from estrogen to testosterone,
Yes.
or we call from DHEA, which is a precursor, gets converted into the testosterone. And these are the reason why these women start noticing a little bit acne on their face, or sometimes hair loss.
Yes, of course.
And that we call androgenic type of hair loss in these women.
Yes. So, well, I would like to talk a little bit about the foods which can help the menopause. Is the, as we know, like with the menopause, the estrogen goes down, so starts going down. So, taking some soy is okay to take, but all the people need to know that soy can be a little bit risky on the people having the thyroid issues. They can't have a lot of soy.
And the other issue with the soy is a lot of GMO.
A lot of GMO.
It's genetically modified, and sometimes it does not goes as well. So, my advice is that if you're going to take a soy product, make sure that it's not GMO.
Yes, non-GMO, and people who has the thyroid issue, they should not be having a lot of soy.
Because it does suppress his thyroid, and that's
Yes.
another creates the hormonal imbalance.
And the other things are like the flax seeds, beans, peas. They also provide phytoestrogens, so people can eat that.
And
more.
the flax seeds are such a wonderful food, and a lot of women will handle it really well. And this is also comforting food for the winter time. It's
Yes.
warm in the and we do recommend making the flaxseed laddus, which are
Yes.
can be made. Every Indian woman know how to make those. And or even having flaxseed, even as a ground flaxseed, adding to your cereals or into your meal, that can be taken. Or flaxseed oil is available.
Flaxseed oil is very good too, and also recommend for the menopausal women that whole grains are very important. They're eating whole grains, whole leafy green vegetables, and the less processed food is the other important thing to do.
I
And-
think what happened with the processed food is that they change quite a bit of the structure of the food, the way they do add other things. So, as we all are so busy in our lifestyle, working all the time, I think women, it's very natural to go for, quick fix, the microwavable foods and all that. So I do recommend, if you're having symptoms, go back to the roots. That means cook your meals,
Cook your meals.
and
Yes.
it's important, and go with the organic.
Go with the organic. And then the Mediterranean diet is very helpful too for which is a consumption of a fruit or like the Mediterranean style diet, which is helps to decrease the vasomotor menopausal symptoms. And the consumption of high fat and sugar diet increases the risk of vasomotor menopausal symptoms. So
that means cut down that.
cut down that.
So doing more wholesome diet.
And then also like the nuts and seeds, as we talked, is the hemp, chia, flax. All those seeds are very helpful in the having the less menopausal symptoms, because these nuts has more linoleic acid and the pyridoxal phosphate. So these are really good.
And like flax also provides very good omega-3 groups. So that's very good, actually, really. It's a cardiovascular help as well. Because as once we have the menopause, our heart and coronary artery disease risk also can increase if there is an hereditary issues going on. And also with the cholesterol imbalance that can lead to a coronary artery disease in the women.
And then some herbs are also, folks, available to help you with as we talked, these herbs are not as doesn't act like a hormones, but these works on your organs to balance the hormones. And ashwagandha is one of that. Asparagus is one of that too. So I do suggest for my patients to take some more calcium supplement, as the osteoporosis is the main concern during the menopause too. So women should take good amount of the calcium and also some vitamin D supplements, so which helps to enhance the absorption of the calcium into the bones.
And it's very, these days we are so much vitamin D deficient because we sit inside and we are not exposed to the sun, and that's the natural way of making vitamin D. So a lot of these women who work in the offices all day are deficient. And also living in the Northwest, it's kind of issue. I call it an epidemic that majority of our population is vitamin D deficient, and vitamin D is so important for the absorption of the calcium in the bones. That's important that you should be on some regimen of taking vitamin D on daily basis, or your calcium supplement should have some level of vitamin D in order for you to absorb. Otherwise, whenever you see a sunshine, do spend some time taking, sitting in the sun to get the vitamin D.
And also, then there is if women are on the hormone replacement therapy, they need to go for a annual should go for mammograms and stuff, because the hormones does get absorbed into the breast tissue. And then there is a risk of the more breast cancer too, along with the traditional hormonal replacement therapy.
And folks, I cannot stress enough that how important it is for the women who, not only those who are on hormone replacement therapies or who are taking hormone for other reasons, doing self breast exams are so important. And October is a month of breast awareness month, and I would like, through this radio show, I would like to tell every woman at least conduct one exam per month, and usually the best time to do is before your cycle. And you are the first one who is going to see a change in the breast.
I always tell my patients, if you will feel your body a little bit more, if there is anything disturbing, you will be able to find out as soon as possible. You go for the annual preventive once in a year, and that's a long time. And if you are not feeling your body, you can miss it.
Right.
And if there is a family history of these type of issues, of course, it's more important. And
getting regular exams is so important. Not
important.
Only, and when you are coming to the doctors, we are kind of doing examinations, but we also don't know what is normal for you and what is not so normal, and sometimes that can avoid unnecessary pain of going through the diagnostic criteria, or sometimes even biopsies, which are very painful. So again, that could be very much a simple hormonal imbalance again. And so a lot of these women also, Dr. Anju, you can have fibrocystic breast, and
Yes, so see, Dr. Shailinder, the fibrocystic breast, it's even harder sometimes becomes to diagnose it for the physician too. Sometimes even with the mammogram too, you can miss it. So if fibrocystic breast, if they feel it more, they will be able to tell. They will be able to diagnose it by themselves.
Right. And usually, if there are cystic changes, diagnostic ultrasound is a criteria. But anyway, one of the things which I meant saying is that these type of changes, which may be very much natural, can put you through the pain, where we might have to say, all right, you need to have mammograms, you need to do MRIs or something like that, when we just know that these type of changes happen with the cycle.
So also, I want to say, the yam is a good thing to eat for the menopausal women too. So that is really helpful with their the symptoms of some of the symptoms it can take care. So if women eat more yam.
Yeah, and that actually helps with the much more of it's like a phytoestrogen.
Yes.
And so it creates that balance in the body, and it's a very good source of also providing beta carotenes and other minerals. So please add this into your diet, on much more basis. So anyway, folks, we are discussing hormonal imbalances on the radio show on the Desi 1250, Your Body's Natural Pharmacy. And we will take a very short break, and we'll be right back more on menopause and hormonal imbalances.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
All right, folks, this is Dr. Shailinder Sodhi along with Dr. Anju Sodhi, and we are discussing very important topic today, which is the hormonal imbalance. So before our break, Dr. Anju was mentioning about the menopause, and one of the things during menopause or perimenopause, we touched a little bit the memory fog.
Memory fog, that's like the major one. Like I get women all the time, like they feel fogginess,
Right.
and they can't think properly. So, there is like the simple, like sometimes I tell my women, like the Gotu Kola is one thing, which is like the Brahmi, and that is great for that too.
And the other common spice is the saffron.
Saffron is great too. Like that has the studies, like with the, there is a study, 35 women with the normal sense of smell were exposed to saffron odor for 20 minutes. And the saliva samples were then collected to measure the levels of cortisol, testosterone, and the estradiol by enzyme immunoassay. And the state rate anxiety was and the result was that estrogen level after exposure to saffron odor was increased in both follicular and luteal phase groups.
And folks, so the mentioning of this study was, the reason is that saffron is so important. When the women are in perimenopause or menopause, the estrogen levels drop. So it's so simple to bring it up because that actually helps the neurotransmitter to connect really nicely. So you are able to recall things. Otherwise, it's a very simple spice which almost every East Indian or Persian families have this in their kitchen.
And even I suggest to take it like at the night too, like in the, they can make a drink, nice drink with it.
And sometimes I kind of, I go into two modes. Sometimes if you're not allergic to cow milk, whole organic cow milk, you can actually make a very nice drink by adding couple staples of the saffron along with the almonds. And that's my favorite drink actually, and it really warms up and it nourishes all the tissues which we need. And this works great for the memory.
Great for the memory. And then the other thing is like smell it.
Yeah, the saffron like fragrance is such a beautiful fragrance. I enjoy that, and I think that actually changes the how our system reacts to it, and it helps. So just having a little bit of essential oil of saffron, or just opening a bottle of saffron and smelling it will change. Right. The other thing is we also want to discuss with the thinning of the bone, which we discussed with the menopause. And the women need to exercise.
And women need to exercise. That's very important, along with the calcium and supplements and the vitamin D, and also the Shatavari helps with that too, with the thinning of the bone too. So women should take some supplements to strengthen their like the hormonal imbalance to improve it.
And sometimes I also recommend to the menopausal or perimenopausal women to do lightweight exercise, because that helps to get the calcium into the bone structure, and it makes the matrix a little bit stronger. So that's how you can get the calcium back into the bone. Otherwise, what happens if you're not exercising? The blood test is not really relevant in a lot of this. It will not indicate if there is they're having osteoporosis or osteopenia, which means thinning of the bone, or maybe fragile bone, because body has a habit of taking the calcium out of the bones, and the blood will maintain its calcium level for a long time. But the moment you start seeing blood level low on the calcium, is already too late. So what you need to do is not only supplementing with the calcium on routine basis, but also adding component of exercise, green leafy vegetables,
eating more nuts and seeds.
That will provide you natural source. And yogurt and all those things need to be done. So anyway, folks, as we're coming to the last 2 minutes of the show, we are discussing hormonal imbalances. So if you are facing hormonal imbalance, which we discussed earlier, like, irregularities in your periods, or, hot flashes, or fatigue, or weight gain, or you've been known to have polycystic ovarian syndrome or endometriosis, all these are indicator of some level of hormonal imbalance.
Hormonal imbalance. So, you can really get help. Like, no need to suffer with those symptoms. And if you have any question, you can see us at the Ayurvedic and Naturopathic Clinic. Phone number is 425-453-8022.
And I and Dr. Anju are practicing at that clinic for last more than 20 plus years, and it's been a really good way to come in, get evaluated, know what is really going on, and we do pulse diagnosis. We also do the blood work and to see the hormonal imbalance, to see, and sometimes saliva testing is done too, which also gives us an indication. And when we have all that information, we provide you with the lifestyle changes, what type of the diet you should be eating, because not everybody can have the same diet.
It starts with from the very early menarche to having the acne issue, having the discomfort, PMS symptoms. We need to address those issues. We need to get with the dietary modifications and the supplements, and the exercise.
Right. So the best thing is to come in and make your appointment at our clinic by calling 425-453-8022, Ayurvedic Naturopathic Medical Clinic in Bellevue, Washington. And this is Dr. Shailinder Sodhi and Anju Sodhi. Thank you very much.
Thank you so much.